All right, guys, now we're going to go over our active threat backpack and the supplies you should have within it. So within the black bags that are on the truck, which there should be 2 of these black bags on your apparatus, you should have a bag of EMS gloves, your triage tape, black, red, yellow, and green. You got 2 red chem lights. These red chem lights are used to mark suspicious packaging or possible explosives that you and your team may encounter in an active threat situation. You'll have 6 of your CAT tourniquets, 6 Israeli bandages, a total of 6 multi-trauma dressings of various sizes, 12 rolls of the rolled gauze, 2 sets of trauma shears, 4 petroleum gauze, 2 chest seals, 3 of the space blankets. And remember that these are used in a hypovolemic patient to keep them from going hypothermic. So cover your patient to keep that body warmth on them. And then you'll have 2 NPAs in there as well. This list should be within your backpack so you can check over it periodically to make sure you have all the items. In addition to all these items laid out, you should have your bulletproof vest, your helmets, your safety goggles, and 2 CBRN canisters as well. Brandon McCulloch with the Fort Worth Fire Department. I'm a firefighter paramedic. We're going to go over wound packing for penetrating trauma like gunshot wounds or any penetrating trauma that leaves an open hole or wound. I'm going to deconstruct this one that's already been done just to kind of show you exactly how much of this trauma packing goes in, and then we'll go over how to repack a wound that's already open. So as you'll see, it takes quite a bit of this. It's almost like doing a clown trick with this scarf when that stuff comes out. For a pretty small hole, that's quite a bit of material. You can do this with a couple of different tools and techniques. We've got the combat gauze in some of our bags as well, which has that blue stripe and it's impregnated with some of the clotting agents. You also do the same thing with a roll of gauze, basically sitting beside where you're wanting to go and using 2 thumbs to then dress that inside of that wound and pack as you go. That gauze should roll out if you put it in a reverse roll right up next to where you're trying to go. Once you get this packed in to a point that it stops your remaining gauze, you can take and shove into the hole, then wrap over it. And this will take, as you can see, almost an entire roll of cling to stop. Which is the purpose of what we're wanting to do with our wound packing. Now that we're at a point that we're stopping, take what's left. You can fold it over how you need to. Take a secondary piece of, or a secondary roll of gauze. Again, using a reverse roll so you can pull some tension on it. Not like this, where you don't have the ability to do so. And then wrapping that as tightly as possible to hold your packing in place and give some extra absorption around the outside of it. And then tucking your excess in to hold what you've got. Okay, today we're going to go over wound packing and why we use combat gauze when available versus just regular rolled up Kerlex. Quick Clot's combat gauze is impregnated with kaolin, which activates factor 12, which is one of the clotting factors in your blood. When you activate factor 12, it initiates the clotting cascade and a fibrogen clot is created from there. So if you look at it when it comes out of this package has 8 tear points around it, so it's pretty quick to get to. Unlike the other Quick Clot brands from 2008 and below, this does not create heat like it used to. If you'll look and notice, it's got a blue woven stripe in there. That's a radiopaque stripe that will show up on x-rays so nothing gets left in the wound when they take them into surgery. This is folded in a Z-fold pattern. You'll notice there's blood here. We don't want to just set this down before we pack. We want to kind of hold this as we're packing in. So you'll start it insert and then just pack from that Z-fold into the wound until you get as much of it in there as possible and there's too much resistance to keep pushing in. Be sure that you explore the wound and make sure that you're getting it in every part of there. Once you get to a point that you can no longer shove any in, you're going to take your excess and just push it down on top, holding pressure, and then you can use regular Curlex to hold in place. So now that we're about to the point that we can no longer pack the wound, flip over, push pressure. You can grab your Curlex in a reverse roll fashion, pulling tension on the wound and your packing. And you can wrap that into place, pulling tension the entire time. Once you've got all of your wound packing covered and tightly into place, take your excess, find one of your folds, and tuck it in over the top of your wound space. So that pretty much covers everything we need to know about the combat gauze and why we prefer to use it over just regular gauze and Curlex. All right, so we went over how to pack a wound and do all that. We're going to add an extra layer of protection with the SWAT tee. We're just going to kind of go over that. These are found in most of our trauma kits, and it should be in your the trauma side of your EMS bag. So you're going to go ahead and open this up. It's like one of those big workout bands or a rubber band. If you look closely at it, it's got stretch indicators on it. It's rolled reverse. When that stretch like it's supposed to, these zipper-looking lines right here turn into squares. So what you're going to want to do is put your starting point on your wound that's already packed. Get your purchase point made, coming around, and start pulling tension on it. Again, those small rectangles or that zipper should turn into what looks like a square at the end of it. It's got indicators on it that show you which way it's meant to be wrapped and what your ovals and shapes should look like. When you're getting to the end of your wrap length, you're going to want to tuck it the same way you would if you were using roll gauze. So we can back off there. And it'll lock down on itself with every layer of wrap, holding the tension that you've created as you were wrapping it. There we are. All right, so now we're going to go over the use of the cat tourniquet on your upper limbs or lower limbs. They can be used on either one. We'll use the proper technique on it. On this one, we have an appendage that's been removed, so we've got active flowing bleeding. We've applied some pressure dressing to it. Has not stopped the bleeding there. You're going to unvelcro your cat tourniquet here. You can either leave it like that, come over the top. I prefer to come out and around. And then feed it back through. You just want to take your slack up on this. And then kind of rotate to where your windlass is going to be on top. and you have full control of it. Wrap your tail around. Then at that point, you can grab the windlass, start twisting, and add your tension. I'll come up that way. We'll do that until the bleeding stops. You can also confirm that the loss of pulse right there, if you still have one. With the loss of an appendage, a lot of times you may not have a pulse present there because there's no back pressure for it. Once that windlass is tight, your bleeding is stopped, you're going to come over the top and secure it so it doesn't come undone. Time stamp it if you can, and then send them off to the hospital. Okay, we're quickly going to go over the high fin vent, which is found in our trauma packs and our active shooter packs. It's got directions on the back, which I'm going to read directly to you. So you just open this up, first step with it, pulling it out, unfolding it is sticky back to this plastic piece, and it comes with a 4x4. We're simulating a gunshot wound right here in the chest. You're going to wipe dirt and fluids away from it, giving yourself a nice dry area. You're then going to peel from the red tab off of the plastic backing, and you're going to put this center area right here directly over your gunshot wound or penetrating chest trauma at that point. So as you place that on, seal it down, you'll see this makes kind of a Y shape. These allow the air to escape while exhaling, and sucks in and seals that off to kind of fix your tension pneumo from happening from the outside there. And that's how to use the high fin vent chest seal.